Peaks of Health Metabolic Medical Center is all about you, and we are happy to have Medical Director Dr. Tracie Linhart back to discuss something very common in our homes. Good morning. Welcome back.
Thank you.
So this is interesting. We're talking about vitamins and minerals this morning, which I feel like we hear a lot about them, but explain what they are, why we need them.
They are so important, and we don't think about it. I actually had to do a lecture at a conference for, family practice doctors, and I didn't realize how much they didn't know, and we're not taught in medical school, but they are the cofactors to all the reactions in our body. So in order to get anything to move, to get insulin to work, to get your thyroid to work, you have to have these vitamins and minerals in your system. So if you're low, for example, magnesium runs 300 functions in your body. So imagine what happens if you're low in magnesium, and about 80% of the American population is low. Because the two things that deplete magnesium, carbohydrates and stress. Who doesn't have either one? So that is so important.
And people don't, it'd be hard to know if you're low on these things, correct? It's got to be hard to keep track of.
It is very hard. We as a society, our nutrient system is so depleted because our food system is so depleted and our diet is so poor most of the time that we just don't get these things. Sometimes just giving a vitamin and mineral to somebody can actually get their strength, their energy, and everything going again.
But not all vitamins and minerals created equally, correct?
No, they aren't. It does get tough.
How on earth? You go to the store, you go anywhere. I mean, there's shelves and shelves and shelves.
I know. We actually are so diligent in what we do. A lot of people don't even know there's 6 kinds of magnesium. So which one do you choose? I have to go over that with my patients, what kind they need for what source. And on top of that, I actually go to the factories of some of the places that we get our nutrients from. We use pharmaceutical grade only. So a lot of times you may get something off the shelf and it only has about 10% of what you think it has in it. On top of that, we only absorb no more than 30% of what we take. So that's the maximum you can absorb orally.
Yeah.
So, and if you have a bad digestive tract, you're only going to absorb about 10% of that. So what dose do you take? Sources, where they come from, China, where they come from Germany, or whether they come from Italy, it makes a big difference as to whether that actual product will work for you.
And can products actually work, or is it better to try to get them from the food? I mean, what's a good balance?
Well, it's always going to be better to have a proper diet. It's always going to be better to get your nutrition from your food. Unfortunately, our food supplies these days are so depleted in nutrients that we're not getting the same amount of nutrients we used to get. For example, they're saying now you need about 7 to 8 apples to equal 1 apple from 40 years ago.
Oh my
so
goodness.
If we ate 8 apples to equal that 1 apple for nutrition, no wonder we have a weight issue.
Exactly.
We have to eat so much more food to satisfy our bodies and feel good.
So what's your hope for people watching this morning? What's your take home? What do you want them to understand when it comes to vitamins, minerals, and making sure we get what our body needs?
Yeah, I mean, the core thing I have almost every single one of our patients take is a good multivitamin. Good omega-3 fish oil. We just don't get enough through our diet, and healthy fat is absolutely necessary for brain function. We also usually have people take vitamin D. We just do not get enough from the sun of what we think. And on top of that, a good probiotic. That is my core for most people. And then from there, we build from what they need based on their symptoms and their deficiencies.
I was just going to say this about you, is I love you say what you need, because you really do, your patients are not just a number. I mean, you really sit down with patients, figure out what is going on, what their lifestyle is, how they feel, and really get to know them.
We do. I mean, medications, 80% of the side effects of medications have been proven to be from deficiencies of nutrients they cause. For example, statins cause CoQ10 deficiency. Most people don't take it when they take the medication. So we go over those lists. We can actually measure the actual nutrients in our patients. We have 2 different labs that do those specialized testings. So we can actually look specifically for what they are deficient in.
And we're not taught this. You don't know what you don't know. I mean, how else
I
are you
had
gonna
no
figure-
clue. I mean, when I started learning this stuff, I'm like, oh my God, do you know what this does? We are not taught this at all. This is just new medicine to us. And it shouldn't be, but it's just something that we have to learn. And it becomes a big part of, taking care of patients' overall health.
Well, and you can tell that this is your passion, is this education component of letting more people know about this. What I love too, you can actually get the vitamins and minerals from your location?
Exactly. Since we do such due diligence to make sure we're getting pharmaceutical grade, we allow anybody to purchase our nutrients. We really look for what companies do the best versions. So I don't think just our patients should be open to that. We opened it to the whole public, so they can get it off our website. They can come to our office and just pick it up. They do not have to be a patient.
That's awesome. But if you do want to be a patient, maybe you want to hear more from her, you're offering a free consult, right, for anyone watching this morning?
Yeah, we do courtesy 15-minute consults for people watching the TV show, mainly so that that they can make sure that we're a good fit, that we can help them. It lets us know if, this is something we can actually do. If I can't, if it's a condition I can't handle, then I'm going to tell the patient right then and there.
I love it. Well, thank you so much again for being here this morning. We always love when you're here because, again, we're just scratching the surface on some of the things that you and your team does. So we look forward to seeing you again soon. Again, take advantage of that special offer this morning.